What's going on, guys? Welcome back to WDYD CSP. What do you do as a central sterile processor? All right, guys, I'm processing some arthroscopic handheld instruments here, okay, used to do surgery on the joints, okay. I'm going to be testing and inspecting my instruments here as well as putting the tray together. But if you guys never seen these instruments before or any instruments, don't be afraid to play with your instruments, guys. Understand how to put them together, how to take them apart, because again, it's going to help you out with knowing how to clean the instruments as well as how to prepare the instruments for sterilization. As always, guys, always take all your instruments out of your baskets, inspect your baskets for cleanliness and any kind of damage, and then start setting it up. Indicators in your basket first, depending on the modality of how you're going to set it up for sterilization, whether you're going to wrap it or put it in a rigid container. Okay, going through the identification process of your instruments, understand what to inspect for cleanliness and functionality. If they have ports, ports should be open. If there's inserts, the inserts should go in smoothly without any rough edges. Okay, if there's any rubber seals, check the seals for the integrity of the seals. All right, just organizing all my instruments in here so I can easily identify them quicker. And these aren't like laparoscopic instruments, so they don't have the common name like Alice's and Babcocks and Maryland's and things of that nature. They have their own unique names like duckbills and baskets and backbiters, upbiters, and things of that nature. So it just takes time to get familiar with the instruments. But again, all your instruments should have some kind of reference number or identification number so that you can match it up to your tracking system and your count sheets, right? What I don't see enough of with arthroscopic instruments is the testing of these instruments. These are used to cut cartilage and, structures within the joints. Okay, check with your repair company to see if they have a testing kit for it. Okay, ours have a nice little dandy little book here, and it's actually a little piece of leather that you use to bite into. Always, guys, as I tell you when you test your instruments, always collect your waste. Inspect over under lighted magnification because that waste leaves residues. For this, it's like little tiny fibers. So that's why I'm using the air gun there to blow those little fibers off the jaw and the tips of the instruments. Okay, and then verifying it under lighted magnification. Because again, we may not see it with the naked eye, but if it lands in the wound of a patient, within the joint of a patient, that's going to cause all kinds of immune response and inflammation that can lead to an infection. So no foreign body should go into the patient. Although it goes through the sterilization process, it is a foreign body. It doesn't belong inside that patient, so that patient's body is going to fight it, it's going to resist it, and there's going to be some complications. So let's not be the ones that initiate or cause that reaction. Okay, so I'm just going through my count sheet, identifying my instruments, and putting them off to the side. Why am I not putting them into the basket? Well, these have a lot of moving parts, so I want to lubricate these very well, okay, to ensure that they're moving smoothly. And some of them, while I'm moving them, I'm hearing like a little, feeling a little resistance or a little clicking, but I'm inspecting for cleanliness and functionality as well as any kind of damage there. And it's, of course, for the biting instruments, I'm making sure that it's a smooth cut that's not snagging, right? Okay, just going along there, gathering all my waste, putting it off to the side there. Okay, and then checking off as I find those instruments, and then just put them all off to the side there. Okay, there's little screws there. Always check the little screws as well, because that's a nice little spot for bioburden to build up. Okay, so remember, dirty hands are touching these. Okay, it's not like this whole instrument is going into the patient, but the surgeon typically uses his hands to touch the patient and uses fingers as a retractor to open up the wound, and he's grabbing these instruments, so he's soiling them up at the proximal end as well, so we should be inspecting that end as well. All right, getting down to the final instruments here. Okay, all right, so let's put everything away. Let's gather my little waste here into the trash. I'm going to go perform hand hygiene and then lubricate my instruments very well. I'm going to saturate them here really good along the track, along the distal jaw, and the actual proximal end where the rings are at. Okay, and then I'm just going to let that sit there for a few minutes. I'm not going to let it air dry completely, but I'm going to let it sit, working it in while I'm spraying, I manipulate them and just blot off the excess and then place them into the basket. And when I organize them into the basket, I organize them by the type. So if they're basket types, I put basket types and things of that nature. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself, and peace.